Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Monday Health Minutes. We're so glad you're here today. We're talking about a really serious subject today. Some statistics show that 12.3 million adults have at some point seriously thought about suicide. So identifying those risk factors and trying to intervene to help your loved ones is so important. Today we're talking to licensed social worker Michaela Whitlow about that. So thank you so much for being here.
Thank you for having me.
This is such an important subject. There's hardly a family, hardly anyone that has not heard from someone taking their own life. So how do you identify that this might be a problem?
Well, there are a lot of warning signs. And if someone doesn't automatically come to you and just flat out say, there could be a number of things: depression, worsening mood, or an increase in their mood, giving away personal items, talking about feeling hopeless, and mentions of being a burden are often big red flags. But the important thing is that you just ask. If a thought crosses your mind, you want to just ask those questions. They're uncomfortable.
Oh, that's a hard conversation to have.
Absolutely, but it has to be done, and it has to be very frank and upfront. Are you suicidal? Are you having thoughts of hurting yourself? Do you have a plan? These are important questions to ask. You don't want to be vague, but you want to be upfront so that the person can feel comfortable coming to you and answering upfront too.
So not just, are you okay?
No.
But you're talking about a very specific, pointed question.
Absolutely.
Are you having thoughts of suicide?
Yes.
That seems so hard.
It is hard. It's uncomfortable, but we're at a point in time in society where these questions have to be asked in order to take care of our loved ones.
Because it is a very real possibility across all ages. You know, it just seems like you hear about it more and more often from young people all the way up into senior citizens, that people are making that very bad choice to take their own lives. So it's a very serious conversation.
It is.
If you feel like my loved one is at risk, what should you do immediately?
You should be with them, physically and emotionally be there for them. And then you can assess what needs to be done next. It may be that they need a higher level of care, so it is important to know what resources are available in your community. Always be familiar with the National Suicide Hotline. Be familiar with the crisis centers in your area, with the hospitals and other clinics in your area where they could go to get help if needed. The two most lethal means of suicide are firearms and medications. So if you know that there's a risk, it is very important to lock those up, to secure them, to store firearms separate from ammunition, and decrease their access to those lethal means.
You mentioned to be with that person. Should you ever leave them alone? Do you need to be with them all the time?
Well, in the moment of crisis, I think it is important to be with them. Eventually, they're going to have to be alone, and so that will be determined by reducing their access to the lethal means, and then coming up with a safety plan that's appropriate for them at that moment. It's always important, though, to follow up with them, and to check in on them. Someone who has experienced thoughts of suicide, they don't just get treated and then they're okay and we never have to worry about that again. It's important that they still know that you care for them and that you're there if they were to experience it again.
And what kind of resources are out there to help families?
Well, depending on your area, like I mentioned before, there is the National Suicide Hotline that's available that you can call if you need guidance. And it's available for loved ones and for you if you know of a loved one who's experiencing thoughts of suicide. So that's available for everyone. And then depending on your location, there are crisis centers that are available to go to if a higher level of care is needed.
And you can always talk to your family physician and reach out that way, and they can help you make connections as well.
Absolutely, yeah. Referrals to behavioral health for therapy and psychiatry if needed after stabilization.
Yeah, the numbers are startling, but there are things that we can do to keep our loved ones safe. Michaela, thank you so much for being here.
You're welcome.
Thanks for being here. We'll see you next week.